The human heart is fascinating. It is about the size of your fist and is located at the center of your chest.
Whether you are consciously aware of it or not, the heart is always working. Your heart is part of the circulatory system. The purpose of your circulatory system is to transport materials. A few of these include oxygen, which is needed for aerobic cellular respiration, nutrients, which are needed for growth and repair, thermal energy to keep us warm, and waste, which is needed to be transported out of the body.
Remember, a true circulatory system has a fluid, which is our blood, to carry the materials throughout the body, tubes, like our blood vessels, for the fluid to travel through, and a pump, our heart, that pushes the fluid.
Your heart is like the leader of a team. It pumps the blood to the body and lungs via the blood vessels. The beating of the heart ensures that the blood keeps moving throughout your body. In fact, it takes less than a minute for the heart to pump blood to each cell in the body. Did you know our circulatory system has two circuits? The pulmonary circuit, which goes through the lungs, and the systemic circuit, which goes through the body. Let's look at how the heart pumps the blood to these circuits.
The heart is divided into 4 chambers. There is a left and right atria at the top of the heart and the left and right ventricles at the bottom of the heart. Remember, in anatomy, we are looking at this organ as if it was inside a person lying on an operating table. The blood enters through the atria and leaves through the ventricles. The ventricles have thicker walls than the atria since the ventricles pump the blood to a greater distance. Adding on, we have a septum, which divides the left and right side of our heart.
The oxygenated blood from your body enters the right atrium. Blood from the upper body enters through the superior vena cava, and blood from the lower body enters from the inferior vena cava. When the right atrium contracts, blood enters the right ventricle through the atrioventricular valve. Valves allow or prevent blood from flowing to a particular part of the heart. So, the right ventricle contracts and blood moves through the semilunar valve into the pulmonary artery, which takes the blood to the lungs. The blood is oxygenated at the lungs and returns to the heart through the pulmonary veins. The blood enters your left atrium this time. The atrium contracts and the blood goes through the atrioventricular valve and enters the left ventricle. The ventricle contracts and the blood moves through the semilunar valve into the aorta. From here, the blood is distributed to the rest of the body. Here's another visual for the blood flow through your heart.
Attached to the aorta are the coronary arteries, which are the heart's personal blood vessels. They help meet the heart's huge demand of oxygen. Now, let's talk about the heartbeat. A full heartbeat, called the cardiac cycle, consists of the diastole phase and systole phase. In the diastole phase, the heart relaxes and fills with blood. In the systole phase, the heart contracts and empties. In fact, the heart is a myogenic muscle because it can expand and contract without signals from the nervous system. The heart has its own stimulations that allow it to beat. So, the cardiac cycle begins when a group of cells called the sinoatrial node sends an electrical signal telling the atria to contract. The signal then spreads to a group of cells called the atrioventricular node. These cells send an electrical signal via the Purkinje fibers, which tells the ventricles to contract.
Here is a demonstration of the heart's electrical signals. The heart can relax and contract without worrying about damage. This is because the heart is surrounded by a double-layer membrane called a pericardium. It is filled with a fluid that prevents friction on the tissues of the heart. Now, let's speak of your heart sound. Your heart makes a lub-dub sound. The sound is from the opening and closing of the valves. If this sound is abnormal, it may be a clue that you have valve disease. Valve disease is a damage or malfunction of the heart's valves. One possible cause is rheumatic heart disease. Some symptoms are irregular pulse, shortness of breath, angina, and swelling. There are 3 types of valve diseases: stenosis, regurgitation, and prolapse. Stenosis of a valve is when the valve is narrowed and won't open completely, so blood flow is restricted. This causes the heart to work harder. Regurgitation is when the valve is unable to close properly, causing blood to leak back into the chamber it came from. This reduces the efficiency of the heart and also forces it to work harder. Prolapse is when the valve doesn't close smoothly, causing small amounts of blood to leak through the valve. However, it is in most cases harmless.
Luckily enough, one way valve disease can be treated is cardiac catheterization. This tool helps perform diagnostic tests on the heart and blood vessels as well as helps doctors treat some heart conditions. A catheter, which is a long, thin tube, is inserted into your blood vessels through a small incision. It can be moved through the blood vessels towards the heart. When the catheter is set, doctors can use instruments to look inside the heart via X-ray and perform procedures. It can also inform doctors about overly tight heart valves, leaky valves, or if the blood is not flowing through the heart the way it should. The heart is absolutely phenomenal. It beats approximately 100,000 times a day.
Remember, the heart works this hard just for you. Your heart hearts you.